Bathing is important to all of us. When a person is clean, they feel fresh and good about themselves. Most Alzheimer patients develop problems with bathing in the middle or latter stages of the disease. These bathing problems can produce several complications. First of all, the patient may have problems with their skin care, things like infection, but also the patient may become unsafe during the bathing process, causing accidents for both themselves and the staff person who is assisting them. Today we're going to help you understand ways to make the bathing process easier and safer. But to begin with, let's look at how the brain helps us to bathe.
Bathing and grooming are an important part of every person's life. Maintaining good personal hygiene helps us feel good about ourselves and keeps us healthy. Brain damage caused by dementia can make it difficult for residents to bathe themselves. How does your brain get you to bathe every day? There are two areas of your brain involved in bathing: your frontal lobe and your parietal lobe. Your frontal lobe lets you know when you need to take a bath. Once your frontal lobe is activated, your parietal lobe tells you how to clean yourself. If demented residents suffer brain damage in their frontal or parietal lobes, they will need your help to maintain good personal hygiene. Residents with mid-stage dementia often resist or try to refuse bathing. Some demented residents forget how to take a bath, how to wash and rinse and scrub. Some might not remember how to wash their hair or brush their teeth. They get into the shower or tub and they don't know what to do. Many demented residents also have trouble understanding your instructions. This confusion is upsetting, and residents may seem startled or frightened. Some may even react aggressively. Demented residents need to be bathed on a daily basis or according to a specific treatment plan to stay clean, healthy, and happy. When helping demented residents bathe, remember that they may be confused and scared. They need your sympathy, patience, and care.
It could be your own mother or your grandmother, and just remember that and take care of them the way you would want your loved one to be taken care of. And remember that you have to respect them. It's not like, it is like a child in a way, but it's not. And there's just there's a balance there that you have to learn. They let her bathe herself, but they were in there with her to make sure that she was safe and that she did get clean. They were good.
Let's look at the parts of the brain that are involved with bathing. Here we see the frontal lobes, which are located right on top of your eyes. These are involved with telling you to take a bath, as opposed to your parietal lobes back here, which are located behind your ears. And that part of the brain tells you how to take a bath. Or, if we look at the larger model right here, we can see frontal lobes, which tell you to get up in the morning and take that bath, as opposed to parietal lobes back here that tell you how to use the bathtub. Now, what happens in Alzheimer's disease? Well, let's look at several specimens from patients with Alzheimer's. First of all, here is what a normal half brain looks like in comparison to a half brain from a patient with Alzheimer's disease. These are the frontal lobes right here in the normal individual that tell you to get up and take that bath, as opposed to the parietal lobe back here that tells you how to take the bath. Now let's compare that to the Alzheimer patient who has severely shrunken frontal lobes and also has severely shrunken parietal lobes. This patient would have problems both wanting to take a bath as well as knowing how to take a bath. Now let's look at what these brains would look like if we cut right through the center right here. Here we see three frontal lobes, one from a normal, mild dementia, and severe dementia. Look at the reduction in the volume as we go from normal to severe. This patient would not want to take a bath in the morning. because the part of his brain that tells him to get up and take it has been damaged. Now let's look at sections through the parietal lobe. This is a normal individual, mid-stage Alzheimer, end-stage Alzheimer. Look at the volume of the parietal lobe right here in comparison to the parietal lobe of the end-stage Alzheimer patient. This patient would forget how to bathe. Consequently, this patient wouldn't want to take a bath, and then once you got him in the shower or the bath, they wouldn't know what to do.
And we were childhood sweethearts. We got married when I was 15 and he was 19. Let's see, it was in '93 that Dr. Otero diagnosed him with Alzheimer's. I just didn't feel like anybody could care for him like I did. And it was very hard to leave him. I would be so upset if he had a new skin tear. I'd cry, and I'd just ask who bathed him and why did he have this new skin tear. And so they finally, I say, if you'll just tell him what you're gonna do, he won't grab you, because he never was aggressive or anything. And it broke my heart when he'd have a new skin tear.
You can make bathing easier and safer for residents by remembering the 3 C's of safe bathing: collect, concentrate, and communicate. Collect all the materials. Make sure you have everything you need in advance. Organize the soap, towel, bathrobe, and anything else you might need so that each item is easily accessible when the resident is ready for it. Make sure that the water temperature is comfortable and that the bathing area is free of hazards that may injure residents. Also, prepare everything the resident will need after bathing. Have powder, deodorant, and clothing laid out and ready for the resident. After everything is collected and organized, you're ready to begin. As soon as you start the bathing process, you must concentrate on the resident at all times. Never let a resident out of your sight while in the shower or bathtub. Be especially attentive to residents who have a history of falls. They are at a greater risk of hurting themselves during bathing. Make sure you have enough time to stay with a resident throughout the bathing process. A demented resident needs your full attention to ensure safe bathing. Finally, it is important to remember to communicate effectively with the resident and with your co-workers during bathing. Always speak to a demented resident in a calm, reassuring tone. Never hurry residents. This might make them upset and frightened. Always give simple, one-step instructions and use visual cues. Use gestures. Point to the towel or robe. And communicate with your co-workers at all times so that assistance is available if you need help with the resident. Additionally, bathing is safer and easier if residents are calm and comfortable. Bathing residents at the same time each day helps to establish a daily routine. Find out residents' past habits and try to copy those habits as much as possible. If a resident was accustomed to bathing in the morning, try to work that into your daily routine. If a resident never took showers but always took baths, try to bathe the resident in a bathtub. Complete the bathing process in a warm, private area in respect for residents' modesty. Make sure you cover the resident with a towel or robe whenever possible. When bathing demented residents, remember the 3 C's of safe bathing: collect, concentrate, and communicate, and try to keep residents calm and comfortable at all times.
I think it's important when you approach a patient that you let them know what you're going to be doing with them. If you approach a patient and you don't express what you're going to do with them, they tend to get resistant, or they're afraid that you're going to hurt them. And so it is important.
There are 5 steps for bathing residents safely and correctly. First, get everything you need to bathe a resident. This includes soap, towel, robe, and other things needed in the shower or bath. Don't forget the things you'll need after the resident finishes bathing. This includes a change of clothes, deodorant, and anything else the resident uses for grooming. Second, help the resident undress in a warm and private area.
Just sit in the chair and come back, take your shoes and socks off.
Make sure you talk to the resident while you are helping.
Baby, I'm gonna take your shit out. Get a bath.
Give simple one-step instructions.
Baby, I'm gonna pull your pants out now. You see it? Pull your feet out.
For example, point to the robe and say, "Let's put this on you."
Baby, stand up and put your robe on.
This way the resident won't become frightened or aggressive. It is important for the resident to remain calm and comfortable throughout the bathing process. Third, bring the resident into the bathing area. Check the water temperature and make sure it is not too hot or too cold. Let the resident feel the water before getting in.
Come on, see the water warm now. Yes. Come on.
This way the resident will know that the water is a comfortable temperature. Remember, it is always important to show and tell the resident what is going to happen before it happens. Fourth, help the resident start bathing. Pay attention to the resident at all times. Bathrooms are a common place for falls and serious injuries. The resident needs your help to stay safe. If the resident has forgotten how to bathe, you will need to help. Always respect the resident's modesty, but make sure every part of the body gets thoroughly cleaned. This is especially important for residents who have trouble controlling urination or bowel movements. Also, check the resident for bruises, injuries, or sores. Some demented residents are not able to report injuries or infections. Report any problems to your supervisor. Fifth, carefully assist the resident with drying. Help the resident out of the bath or shower. The drying area should be warm and comfortable. Cover the resident with a towel or robe whenever possible. Make sure the resident dries off completely before getting dressed. And sixth, help the resident get dressed using the clothes you laid out at the beginning of the bathing process. To make it easier for the resident to get dressed, the clothes should be in the order that they will be put on. For example, undergarments are first and shoes are last. Using these simple steps when bathing your residents will make bathing safe and easy. These steps will also help residents stay calm and comfortable. Remember, residents are adults and deserve your respect. They may feel embarrassed or shy in front of you. You should do everything you can to make the bathing process easy and comfortable for them.
Miss Fisher is often resistant during bathing. She is very frail, and you're worried that she might get injured. What can you do to help Miss Fisher?
2 big, strong workers should definitely restrain her during bathing.
Ask Miss Fisher's daughter for suggestions on how to bathe her without upsetting her.
Give Miss Fisher medicine to sedate her during bathing.
Tell her family she is unmanageable and must leave your facility.
Mr. Cook fights when you begin to disrobe him in preparation for bathing. He seems scared and upset. What can you do to help Mr. Cook?
Stay calm and try to reassure him by speaking in a soothing voice.
Show him his bathrobe so he will know he can cover himself after he takes off his clothes.
Make sure the room is warm and private. Mr. Cook is very modest.
All of the things mentioned above will help Mr. Cook stay calm and comfortable.
Ms. Wolf appears startled and alarmed when you place her in the shower. When you turn on the water, she begins to scream loudly. What can you do to help Ms. Wolf?
First, place her hand in the water so that she can tell whether it's warm or cool enough.
Ask Ms. Wolf's son if she prefers baths or showers.
Proceed gradually. Give calm, step-by-step instructions.
All of the things mentioned above will help Ms. Wolf stay calm and comfortable.
Mr. Ross gets upset and sometimes fights when you attempt to bathe him. He seems to be more comfortable with men than with women. What can you do to help Mr. Ross?
Ask men in your staff to help in assisting bathing Mr. Ross. He'll be less anxious and more cooperative with men helping him.
Gather enough women to hold him down when he fights.
Give Mr. Ross medicine to sedate him during bathing.
Tell Mr. Ross's daughter that she needs to take him home. He is unmanageable.
Mr. Palmer has mid-stage Alzheimer's disease. He often becomes agitated in the late afternoon or early evening. Mr. Palmer was a farmer who only took baths on Saturdays before church. He doesn't like showers. What can you do to help Mr. Palmer?
Remember, he's not used to bathing frequently, but make sure he bathes often enough to maintain good hygiene.
Bathe him in the morning, not in the evening. Mr. Palmer is more likely to get upset in the evening.
Use a bathtub, not a shower. Mr. Palmer doesn't like showers.
All of the things mentioned above will help Mr. Palmer stay calm and comfortable.